Okay, we're with Dr. Tressa Pinkleton from Seattle, and today we will be addressing the length of time on the protocol. For myself personally, um, I'll just interject this real quick that it took a lot longer than I thought. I was told at the beginning that it was 2 years. I think I had primary progressive. It was probably closer to three before my disease stopped. And that is something that Dr. Coimbra has said that it takes a little longer with primary progressive. I'm going to read a little disclaimer here, and then we'll go right into Dr. Pinkleton and what she has witnessed in helping people through the protocol. This interview is from our own personal experience, and we are not talking in specifics with generalities, not referring to any individual or particular cases. We are not giving medical advice. Medical protocols and methods of treating should be done with a licensed medical professional. Good morning, Dr. Tressa Pinkleton.
Good morning, John. How are you?
I'm doing well.
Yeah. Okay, so length of the protocol, honestly, it really runs the gamut. And it is the, whenever in my first appointment, I spend a good 15, 20, sometimes 30 minutes explaining all the ins and outs. And at the very end, I say, okay, do you have any questions? And pretty much every time the first question is, how long does this take to start working? And it's really individualized. I tell patients sometimes you feel better within a couple of weeks or 3 months. Sometimes it takes 2, 3 years. That's what Dr.
Wow.
Coimbra trained me in and to say, and how he counsels his patients as well. It's the trickiest part of this protocol as a practitioner for me is keeping people patient and encouraging them to just wait it out. And I understand we all want to feel better right away, right? And
Yes.
the protocol, it can be a little bit involved. You have to change your diet, you have to drink lots of water, you have to exercise regularly, and these things can be challenging. And when one puts in a lot of effort to do all of that, and they're still symptomatic in a way that really bothers them, it can make them question what's happening. And so I just continue to try to tell my patients, just give it some time, and you've got to let your body heal. A huge part of how long it takes to work, right? And remember that success of this protocol is a cessation of progression. So sometimes it working means you don't get any worse. Sometimes it working means you start to regain some function. But if you don't start to regain function, however, you are stable, that's a success in my book, in Dr. Coimbra's book. That's a good thing. But anyways, one of the major contributing factors that I've seen in my practice is the amount of stress one has, and getting that stress level down so that the body can actually repair. We have it, really simplistically speaking, we have kind of two sides of our immune system. We've got the fighting side. That's what's activated when you get ill. That's what's activated inappropriately with autoimmune disease. And we also have the healing side, right? When you cut yourself, your immune system helps to heal that wound, right? And if we're really stressed out, that healing side of the immune system has a more difficult time to engage. And that is why Dr. Coimbra and myself really try to stress that stress reduction picture of the or portion of the protocol. Because if you are super stressed out, your fighting side of the immune system is going to continue to be engaged, and you're going to continue to have symptoms, and you might continue to progress despite the protocol, because you're not able to calm that down. And that, that conversation always leads to an even larger conversation of what's going on in one's life. Is there a way we can help? Do we need to bring on nutraceuticals or amino acids to help rebalance the neurochemistry? Do I need to send somebody to, if they're an out-of-state client, to their healthcare provider for medication? If they're one of my patients, then sometimes we talk about prescriptions. But that stress component is really key. And the patients I've seen that have either stopped progressing or regained function the quickest often have a very, very low stress level.
When I started this, I was at about 9 months, and I contacted Yara Wanderlust in Mexico, the head of the Mexican Coimbra group, and she'd gone through the protocol. She gave me the best piece of advice that I've had since I started this. She said, patience, patience, patience. And when you feel like you've ran out of patience, go out and find some more. And I was like, and that is totally, totally true.
Yeah,
I mean,
no, it really is. And, I think we talked about this the last time I came onto your podcast, of the efficacy rates of the protocol and how I found them to be a little bit different up here in the States than down in Brazil. And one of those components is that people in the States are really impatient. And I've
yes,
had
we
people
are.
come to me, their second follow-up. They have only been on the protocol for 6 months. We haven't gotten their PTH to where I want it to be. And they're saying, yeah, I'm not sure about this. I don't think it's working. And I go, it hasn't even been a year. You got to give it patience.
You know what I say often, I'm sorry I interrupted you.
Okay.
What that is like you take a ship out onto the sea and it starts getting rough, meaning nothing's happening or something's happening and you don't like it. And instead of riding it out and being patient, you jump over the side, start swimming for land. That's what it's like when you quit after 6 or 8 months. You've got to ride it out. And I tell people that all the time, and I know it's hard.
It's hard. And I have, compassion and understanding for that emotional response to having disappointment when 6 months in you're not feeling the way you want to feel. I understand. But the patience thing is a huge part of, or the lack of patience of, our culture here in the States. And I think that kind of plays into how people view the protocol here versus in South America and in Germany, because those cultures tend to have more patience embedded in them.
I would totally agree. Well, Dr. Tressa, that has been about 10 minutes already.
Right.
We're going to try to keep these interviews down for people. If you haven't, I encourage you to get your supplements. I got mine this week. Thank you, Dr. Tressa, for sending those to me. And make sure you're taking your magnesium. That's something we're going to address next time, is magnesium consumption and just the things that we take to help vitamin D stay in our systems or to be used in our systems. But this is something definitely that I've noticed that, with the other vitamins, that's something to address too, is when I started, it was vitamin D, magnesium, and riboflavin of vitamin B2. And basically that was what we took. And then as time has progressed, Dr. Coimbra has added a few things to it. And people like yourself have added things that we should also be taking. So anyway, thank you again for sending that. And until next week, we're just going to have what we call a few moments with Dr. Pinkleton. We're not going to take a lot of her time. We don't have a long attention spans in the U.S. anyway. So I think we're going to try to keep them around 10 minutes. Dr. Pinkleton, thank you so much. And we look forward to more interviews.
Yeah, me too. Take care.
All right. Take care. Bye.